the implant system works for the mini implants that are fully guided above the bone. So here you can see we've got a guide with a surgical tube in it, and the surgical tube has additional tubes that go in it. The first stage that you would do is to find the smaller of the two pilot drill guides and place that in there. Then you're going to drill the pilot hole. Once you're done with that, if you need a larger hole for a larger implant, you would use the larger pilot guide. After you've got the hole drilled, there's a 15, a 13, and a 10 millimeter bushing. You pick the correct bushing for the size of the implant. So if it's a 15 millimeter bushing, it's a 15 millimeter implant. These are going to go inside, just like that. And then the interlock drill with the implant in it is going to slowly slide down the inside of that channel, very tightly keeping it on track all the way to the bottom. So you're going to bury the handpiece all the way to the top, and when you've done that, you know that the implant is within a millimeter of the tissue below. If you pull that off and you find that you want to go deeper, just take the next size bushing down, and you know that you're going to drive that implant in 3 more millimeters. That should take it just under the tissue if you need it to. We're just moving the guide over. So that's your 1.25. Let's see. It's pretty far lingual, like you said.
Mm-hmm.
You look at it compared to the teeth that were there. It shows how much resorption there is. We're just pre-drilling all the pilot holes.
You're doing great, Piggy.
Oh. Gosh, we need Dr. Dorius because this says, holy heck.
That last one.
Then we went up to the two.
So now we're going to switch drills. Okay, so just switching to the larger drill bushing, the 2.0. And this one we're not going to go down as far. We're going to go down basically to the depth of the collar. So once we feel it hit the bone, we're going to go down 4 millimeters, which is 2 millimeters of each of the collars on this particular brand of implants.
I can add more numbing if it's pinchy. You raise your hand.
Okay. So same thing, just going through, making all the pilot holes to the depth of the collar.
Your finger might be in the way for me to, so kind of take it on the lower part there. There you go. Perfect.
Just stabilize.
And hold right on the teeth. There you go.
So again, we're not going to full depth, we're just taking away a little bit of extra thickness on the collar.
And the heel stop.
This bone is quite hard. It's a D1 bone, so that's the purpose for doing all these holes instead of just making tiny little perforations.
Then we'll go to the largest burr.
It's over here on the left.
Okay.
This one?
Yep.
And then the current osteotomies are going to guide this last burr that's a 2.5. So she's just going to go in until she feels herself hit the hole and then go down just to the depth of the collars, which is a couple millimeters, just to widen it so there's less friction. You can see just a little bit of bone there on the apex. This is only needed in the harder bone. Just relieving some of the cortical plate. So we placed the first implant at 60 newtons. It bottomed out. So that's when we decided to make these holes a little bigger. Okay, so we're back here, and we just have the guide tube in. So there's a 10, a 13, and a 15 millimeter guide tube. Each one corresponds to the length of the implant. And she's got the tube in, and she's just hand threading it down. Now the way it's designed is the top of the handpiece will bottom out on the top of the tube when the implant collar is flush with the top of the tissue.
You hold the guide.
So there's the guide tube in place. Just like so. And they're stabilizing that.
Perfect, Glenda.
So we'll grab another one.
Yep. You have another one, Joe?
Same one?
I need it off. The handle's in the way.
So in this particular case, it was so short that she couldn't get any apical stability of the implant to take the driver that comes with the implant over.
Ideally, but
So
I don't
she
see one.
hand threaded it with the tube off, then put the tube on, and the tube is
Joe,
going to
can
guide
you
it to
find
place,
two?
and then also get it all the way to depth. So there she's on. So she's driving it into place. And when she bottoms out, here she's done. So we're going to take the tube off. And we can get a nice little picture to show where that's at inside there. Can you open it
Can you
any bigger
open a
for me?
little bit bigger, Peggy? Thank you.
So you can see it's right in the very center. And then we're going to keep doing that for all of them. So the guide's versatile in that different implant systems have different carriers. So what she did here was hand thread the implants in. Now she's putting the guide tube on, and she's going to use that to place them accurately where they're supposed to go so they can't go off direction anywhere. So they're just barely sticking inside the holes right now, and now she's driving them all the way to place.
Lots of
And
pressure.
then each time she's going to move the little guide tube over so that it stays accurate. So these are 13 millimeter implants, so she's using the 13 millimeter guide tube. And she's going to keep pushing until the top of the handpiece is flush with the top of the guide tube. Yeah, it doesn't look like you've gotten that one all the way in. I think you have about 4 millimeters to go. Pushing, go, go, go. About 3 millimeters to go. And it's pretty hard cortical bone, so if you have to pre-drill a little more, that's okay. Slide it over to the next one. See if that one will go in all the way, or if we have to drill some more. And keep going, you got about 2 millimeters more.
Lots of pressure, Piggy.
A little more, another millimeter. Okay. Yep, three tubes, so there's a 10, a 13, and a 15. So if you're using like a 16 millimeter implant, it means you're going to be 1 millimeter taller. So when you take the guide off, you just have to put it in the last millimeter, the way it is. But other than that, those 3 sizes are very normal, a 10 or 13 or 15. So if you're in the bone 15 millimeters, the last 3 millimeters on an 18 millimeter implant will still thread without going off track. So that's why there's the 3 sizes, just because you need something short to keep you where you need to be if you're in a 10. But you also want to have it guided longer if it's soft bone and you're trying to get past the apex of an extraction socket or something.
You can close down a little bit right now.
All right.
Does that hurt down there? Okay.
Yep. So we have tetracycline that we put the implant in. So we're putting that right into our site. It's really nice if we have an immediate extraction site or some kind of pathology that we dealt with at the same time as the tooth removal. Or if we just want to reposition our implant, it's a good way to get those antibiotics in there to help it heal without actually having to give them systemically. And it's going nice now. Good. It's at full depth.
Probably not quite.
Maybe we need another millimeter.
We need to go up to 3. Good.
Okay. So if you hear the little click, it means with the interlock drivers, they don't hold the implant as tight as we want sometimes. So that click is where it'll start to go around the corner. So I have that other driver that's a little bit tighter. And so initially we want to get these down, or we can use a ratchet driver. Those tend to be held to a little bit tighter tolerance than the handpiece drivers. And the handpiece drivers, of course, are, they wear out over time. So you never know what you're going to need to do. Right now this is in there really tight, so she's just grabbing a hemostat to bring it out. But it's good so everybody can see, what you need to do to make these things work, because this can happen with or without a guide. You just need to get this, driver out of there. Sometimes if you use like 60 newtons of torque, the latch will actually stick inside the implant handpiece too. So I try not to go over that when I'm using the handpiece drivers. We're on our last implant. Guide tubes in.
Lots of pressure. You're doing great.
This
is our last one.
Cortical bone. And
Just
just
3?
bottomed out on the top. 3. Okay. We're just getting it off. Driver out. Okay. Now that you loosened it, why don't you go ahead and got
Take
it
it
out
off.
before you even got to try in reverse. Can I see what it looks like with the implants in the holes? Can you open up that for me? Open any bigger? Yeah, I want to show how the implants are in there. But can you open any bigger at all? That about it? Okay. Let's go ahead and take the guide off. And let's take a peek from the front. So
Nice implants,
there are
Peggy.
our implants. There is our bridge. I think they look really nice.
They look
So any final
fabulous.
adjustment heights I just do
Good
with like
job.
a ratchet. Good job.